Okay, so welcome to this special Valentine's Day edition of It's Worth a Shot. Today we're going to be going over American Heart Month and adverse drug events. Next slide, please. We do have internal speakers, so speakers from Mountain Pacific today, but we just always want to have the disclaimer that if we do have third parties on, that does not mean that we constitute endorsement or recommendation by Mountain Pacific. We are just trying to share information with you guys to the fullest. Next slide, please. Okay, so we have a little bit of a different updates and reminders today. Second on the reminders list, you can see there that the Centers for Medicare and Medicaid Annual Quality Conference is coming up. It's April 8th through the 10th in Baltimore. There's going to be both in-person and virtual this year. So previously it's been virtual due to the pandemic. They are opening up for the first time for in-person. And then today we're not going to have a polling question. We just have a request. So next week, we're going to go over management strategies for people living with dementia, and it will be a return speaker, Dorothy Colby, who did kind of the first part series of this. What we're looking for from you guys are any scenarios that you would like discussed that have to do with management of people with dementia. So if you have any scenarios that you want us to discuss or to potentially have put into the webinar for next week, can you please email them to Jolene? And there's her email address. You can enter it into chat during this webinar if you want, or you can complete our It's Worth a Shot evaluation. And there's sections where you can do write-ins and you can write your scenario in there and let us know. But we're just looking for a little bit of participation for next week's webinar. So if you can go ahead and think of any difficulties you guys are having or any scenarios that you would kind of like us to tackle, we'd really appreciate your input. Next slide. And as always, we thank you for joining us every Wednesday, and we look forward to many more with you. Next slide. All right, so our influenza snapshot. Wyoming is still looking very high for the influenza outbreaks, but looks like our trends are kind of evening off or trending downward. So that's good. The hospitalizations are trending downward, and so is the monthly mortality, which is great. Next slide, please. And for COVID, Alaska is still in the stable to increase, and looks like Hawaii is doing rather good with a substantial decrease. And then we just have some mixed feelings, I guess, in Montana and Wyoming. So looks like the national trends are trending downward, which is always good. And hopefully we can kind of come out of the COVID/flu season and enter into a very healthy summer season with all kinds of quickness, especially because I'm in Alaska and we have record-breaking snow this year. So I'm looking forward to upper trends of temperatures and lower trends of illnesses. So everybody fingers crossed. Next slide, please. All right, I'm going to hand it over to Kyla, who is going to discuss Heart Health Month. Kyla, you're on mute. There you go.
Thank you, Miranda. How timely for us to celebrate Heart Month on Valentine's Day. So I'm happy to bring you some information forward about taking good care of your heart. You can go to the next slide. So just a nice little kind of diagram, I guess, picture that our comms, I have to give a shout out to comms because she put this together. It kind of just talks about all the reasons or all the ways that you can help keep your heart healthy with these little Valentine's hearts. So I thought that was pretty cool and very timely for our discussion today. One of the American Heart Association themes is love your heart. So you can go to the next slide. So I just wanted to kind of level set us with heart terms because we hear a lot of things being tossed around. Heart disease, heart health, cardiovascular disease, coronary artery disease, peripheral artery disease. And so if you think about these terms, essentially heart disease is kind of encompassing all of these things. And it being our circulatory system, it may involve the heart and it may also involve the end organs that our heart is supplying blood to. And so if we think about heart disease, it's kind of just like the all-encompassing term. And you can think about it like that. And technically, it could be classified as coronary heart disease if you really look at the definitions in more depth. We can go to the next slide. So, as we're talking about it as a whole, it is the leading cause of death for men, women, and people of most racial and ethnic groups in the United States. One person dies every 33 seconds from cardiovascular disease. So you'll see right there using an interchangeable term, cardiovascular disease and heart disease. And about 695,000 people in the US died from heart disease in 2021. So that's essentially 20% of the deaths that we saw. So huge impact, big player in the healthcare system, and really a hard disease to manage with kind of like the multifactorial things that you need to look at. We can go to the next slide. So how do we get started? There's tons of things that we can do to keep our heart healthy. And these are kind of the things that we do in general to stay healthy. So get enough sleep, maintain a healthy weight, eat a good diet, be active. If we look at the recommendations for activity from the National Institutes of Health, 30 minutes of activity 5 days a week, so 150 minutes a week, is the recommended length of time to get that heart rate up above our resting heart rate. And this doesn't even have to be 30 minutes consecutively. You can do 3 10-minute sessions. So if you feel like you don't have the endurance to do a 30-minute walk, you can do 3 10-minute walks. And that's just getting your heart. Doesn't mean you have to be in the fat burning zone or really doing some extreme cardiovascular activity. It's just getting your heart rate up above that normal resting level. We know that cholesterol is a big factor in heart disease, managing that, managing blood sugar. So diabetes can have some crossover with heart disease just because elevated blood sugars for long periods of time can actually cause damage to those blood vessels and increase the inflammation and also contribute to atherosclerosis, which is going to be that hardening and narrowing of your arteries. Managing stress, we know that's huge. Managing blood pressure, also a very good way to keep your heart healthy. And that's actually the one I'm going to focus on primarily today. As we'll see, it is very undertreated. And then last but not least, practicing self-care and finding social support. So just really maintaining kind of your mental health as well. We can go to the next slide. So many of you have probably heard of the Million Hearts campaign. And one of their main kind of themes is the ABCs. So this is a good thing to look at when you're looking at the factors that you can do to keep your heart healthy. So taking aspirin for many folks is recommended. Usually it's going to be a low dose aspirin, but definitely something that you want to make sure you clear with your healthcare professional. Control blood pressure, control cholesterol, and stop smoking. So these are just kind of the top things that go in there for your ABCs. We'll go to the next slide. So I'm going to have us, if I can share my screen, Mary, take a quiz. Screen has that up. Oh, here. I'll jump over. This is something I wanted to mention too, so I'm glad this popped up. There is a statewide coalition in Alaska, the Take Heart Alaska Coalition, and I can put that information in the chat too if you folks would be interested in joining that group. So let's see. My bar is over the, oh, here we go. Okay, are you seeing the quiz? Blood pressure basics 101?
Yes.
Yes,
okay.
we're seeing it.
So it's going to be 5 questions. And I would love if you can come off mute or throw in chat what do you think the answer is? So high blood pressure can hurt your heart in many ways. Which of these organs can be affected by the condition?
All of the above.
Thank you, Miranda. Yes, that is correct. So as I mentioned earlier, because your heart is pumping oxygen to all organs in your body, we can look at damage in all of these areas. So why is high blood pressure sometimes called the silent killer?
No symptoms.
Yep, exactly. Many people do not know that they have high blood pressure. Where can you get your blood pressure measured?
All of the above.
Correct. And I like to highlight too that monitoring at home is always a good idea. And there's actually there's self-monitoring blood pressure that you can utilize too, where a provider will actually be able to see the readings that you get at home, because often people have like white coat hypertension, where they might get nervous when they go to the doctor's office, and then their blood pressure is naturally going to go up. So about 1 in 2 US adults have high blood pressure, which is characterized as greater than 130/80. And what percent of these patients have their blood pressure under control?
I'm guessing 50.
It is actually 25%.
Ooh, I gave us more credit.
Yeah, so wow, this is a pretty drastic statistic, I thought. Adolescent and young adults can have high blood pressure.
True.
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 So blood pressure can be hereditary too. You can be doing all the right things and you still have high blood pressure just because it's something that you inherited or something that runs in your family. Great job. Yay. 5 out of 5. Okay, I can stop sharing. We can go to the next slide. So this is just kind of reiterating that statistic that only 1 in 4 adults with hypertension actually have it under control. And 45% with uncontrolled have blood pressure greater than 140/90. That's going to be 10 millimeters of mercury over on the systolic portion. And this that's a statistic that's not just in the United States, but about 37 million of those folks are in the United States. And about 34 million who are recommended to take medication may need it to be prescribed and to start taking it. So this is those people that are untreated. And 2 of 3 of this group have blood pressure 140/90 or higher. And this is a huge cost to the healthcare system, as you can see. We can go to the next slide. So this is just a map that kind of shows rates across the United States. I thought it was kind of interesting. You can see in our states, there's small pockets. In Alaska, there's actually kind of this large pocket that has a higher percentage of patients with hypertension. We can go to the next slide. So this is just basically kind of reiterating the same fact again. We've got these people, we've got some that are controlled with lifestyle, but we've got a significant portion that's uncontrolled. And if we talk about lifestyle changes, we're talking about some of those other things that I talked about: healthy diet, low sodium diet, exercise, weight loss, etc. We can go to the next slide. And as I mentioned, the DASH diet, that's dietary approaches to stop hypertension. You folks may have heard of that. So kind of looking at these 2 charts, seeing what you need to eat more of, what you need to eat less of. Limiting alcohol will also help. And as a last resort, which is the main approach for many folks, we do need to utilize medications and make sure that patients are adherent to those medications as well. And we have a lot of medications to treat hypertension also, so there's a lot of options out there. You can go to the next slide. And that's my resource slide. There's a nice blood pressure fact sheet and a cholesterol fact sheet that I thought would be good resources. There's also a Go Red for women. We know that heart disease is underdiagnosed in women, and oftentimes women will have a little bit different symptoms than men. So there is kind of a campaign just targeting women as well. So I appreciate your attention today. Callie, I think I went 1 minute over. I will turn it over to you unless folks have questions.
All right. Thank you, Kyla. Just so you know, Kyla, we dropped in the Alaska Take Heart Coalition and we put the Million Hearts link in the chat for everyone. So if you guys are interested in learning more about those two efforts, take a look at those. And let's go ahead and go to the next slide. So today we're going to be talking about adverse drug events. And Kyla actually is presented on adverse drug events in a couple of different It's Worth a Shot. So we just wanted to kind of remind you guys about the prevalence of adverse drug events across our region. You can see that in Alaska, the anticoagulant use is a little bit higher, whereas in Wyoming, opioids is number one. So you can kind of see the difference. But when we're talking about, kind of why this is important, there's a lot of data out there on adverse drug events, and they've identified that approximately 95% of these are predictable and about 28% of these are preventable. So we want to present some different options today on reducing the number of adverse drug events in our states. And, obviously there's adverse outcomes for our populations, our geriatric population. So we just wanted to, let's go ahead and go to the next slide. So before we get started, I wanted to just kind of clarify some definitions. So the first one is potentially inappropriate medications. Now, this is important when we talk about different criteria that we're looking at, and I'll get into this a little bit more. But the potentially inappropriate medications, these are a definition used in older patients. When we're looking at those adverse drug events, there's criteria for those medications. The key word here is potentially. So there may be times when a medication is on the PIM list, but that doesn't necessarily mean that it's always inappropriate for use and that you would never use that for one of your residents. So they just consider them potentially inappropriate. And again, we'll get into that a little bit more. And then on adverse drug events, it's an anticipated or unanticipated side effect of a medication that your resident has received. And to kind of differentiate between adverse drug event, the adverse drug event is the side effect, whereas the medication error, that can be, a dosing error or a prescribing error, or, maybe they received it the wrong route, the wrong time. Maybe they didn't receive it at all. So just to kind of break those and, break them apart and delineate between the two, what we find when we're working with our coalitions and our nursing homes, we often find that facilities have policies regarding medication errors. They have audit tools and they're reviewing medication administration practices and education, all of the things regarding medication administration. But oftentimes they don't have a process for kind of digging deeper on adverse drug events. So one of the things that we're really trying to provide some education and some assistance on is developing those policies, procedures, processes for reviewing adverse drug events, and then, taking that proactive and preventative approach to adverse drug events. So let's go ahead and go on to the next slide. So on this slide, we've broke down a couple of different risks when it comes to adverse drug events and identified some potential mitigation strategies for each. So when we talk about adverse drug events, obviously the first one could be a medication error. If somebody receives the wrong medication, they can have adverse drug events from that. So a couple of mitigation strategies to consider would be implementing those high alert meds, providing some education, doing those high alert med lists, identifying look-alike, sound-alike medications. I know a lot of times with packaging, the pharmacies will send over, the little stickers that have the look-alike, sound-alike medications on them, or any kind of visual alert when a medication is changed, whether the color of the medication is changed. So just that kind of visual alert. Making sure that you do have those medication administration, education, policy, audits, making sure that your staff are competent and when they're providing the medications. The next one are those potentially inappropriate drugs. Again, your PIMS, looking at those medications. There's several different tools and resources to help identify the medications that you potentially don't want your residents receiving. So we're going to talk a little bit more about the Beers criteria at the stop and start, and then the armor tools. So we'll dig into those a little bit more. And then the next risk is polypharmacy, of course. There's a lot of risk at every transition of care. There's a risk of a medication error, additional medications are ordered. There's a lack of handoff and communication at those different levels of care. So making sure that you're doing, good reconciliations at each transition when possible, making sure that your systems are interoperable and they're talking to the other levels of care so that those medications carry over. With your electronic health records, something that's recommended is the computerized physician order entering, so that when they're putting in orders, they can see that it's already prescribed. Maybe they need to discontinue a medication and, start a new med. It will show them what medications are already on board. It'll show them doses. So that's another good suggestion. Making sure that you have that interdisciplinary team, having that pharmacy-led medication review when you're doing your drug reviews, all of those things help reduce the potential for polypharmacy and any kind of potential errors that may occur during that time. So let's go ahead and go to the next slide. So this, I told you guys I was going to talk about the Beers criteria a little bit. This is from the American Geriatric Society. They have identified medications that are potentially inappropriate for our residents, and they have it broken into 5 tables. So they talk about medications potentially inappropriate in most adults. Then the next table has it broke down by certain conditions. So such as heart failure. The next one are medications that should be used with caution, such as diuretics. The next one are those drug-to-drug interactions, so avoiding like warfarin and any kind of NSAID. So, and then the next one talks about kidney function. So as you work through the Beers criteria, you can look at the medications that are inappropriate for most and, try to kind of weed those out as you go through the criteria. It also lists the medications with strong anticholinergic effects. So again, just another one to look at. They do update the Beers criteria every couple of years. On average, I think it was every 3 years. So if you have an old one, maybe make sure you have the most recent version available. When you use the Beers criteria, it should be thought of as kind of a warning light to help identify those inappropriate medications. And the medications decisions should be individualized and based on what is needed from the resident and discussed between the healthcare team and your resident. All right, let's go ahead and go to the next slide. So the stop and start criteria is another great resource. The criteria help identify, again, potentially inappropriate prescribing. There's several criteria. I think the most recent version has 133 stop criteria and 57 start criteria. And it's basically just what it says. So STOP stands for Screening Tool of Older Persons Prescriptions. And just like it says, it would indicate criteria of when you would want to stop the medication because it could be potentially inappropriate. And then on the flip side of that, there's criteria that help you identify when you would want to start a medication, when it would be appropriate to use that. So again, these are just really great screening tools kind of to be used together for when medications would be appropriate and where the risks would outweigh the benefit to the resident. So let's go ahead and go to the next slide. And I wanted to just touch on the Armor tool. This is just one more tool that's available. And I kind of liked, there was an analogy that they had given about Goldilocks and the Three Bears, about how medication prescribing is a lot like Goldilocks when she's trying to find the right bowl of porridge for her. Well, our approach to medication is kind of the same. You know, sometimes we have to kind of try something and then we get it too hot and so we need to back off, and then it's too cold, and then we kind of come to the middle and find just that right bowl of porridge or the right medication and prescribing approach for our residents. Well, the Armor tool is kind of that. It pulls it all together. It helps consolidate all of the recommendations from the Beers criteria, looking at those drug disease interactions. So it talks about assessing all of those things ahead of time, reviewing all of the potential adverse reactions, what steps you need to take to make sure that it's the most effective dose for your resident if you are going to choose to use it. And then let's go ahead and move on to the next one. And of course, I did just want to touch on medication reconciliation. Just as a reminder, when we're doing this med reconciliation, we want to make sure that we're following each step of it. So verify, make sure that you're looking at the most accurate current medication history, make sure that the medication and the dosage are appropriate, and then reconcile. So make sure that when we're doing our reconciliation that we are also taking into account those over-the-counter drugs, the herbal supplements that they may be taking, vitamins. Make sure that we pull all of that in. And when we do the reconciliation, make sure that you're doing your drug-to-drug interactions, drug-to-disease, and then any duplications as well. Let's go ahead and go to the next slide. These are just a few resources on our previous It's Worth a Shots. There's some additional resources that Kyla discussed. We just wanted to provide you some more education, more information. This is such a vast topic that we could probably do multiple days on this topic and all of the tools. But just as a reminder, Mountain Pacific is here for technical assistance. If you guys are needing some assistance, finding one of these tools or implementing the tools, having the conversations with the residents or the family members, providers, don't hesitate to reach out. We would love to assist you with that. And do you guys have any questions for us today on either topic?
Hey, Callie, this is Kyla. Yeah. So I was just going to mention that the Beers criteria, if you actually want to see the list, it is only accessible if you're a member of the American Geriatric Society. So I was going to share it in chat, but I only have a PDF version, and I can make sure that gets sent out after the call if folks are interested in that actual resource as well.
Yes, and Far America also put out a Beers criteria, kind of a, did you know
Mythbuster
resource.
type thing.
Yeah.
Yeah.
Yep. And
I saw that.
I put that link in the resources as well. So if that's something that you guys are interested in, that's just kind of a quick and dirty version that you guys can take a look at, and then kind of determine if that's something that you would want to implement during your medication reviews. So, all right. Well, if there are no questions, please make sure you guys fill out the evaluation for today. Yeah, I can definitely do that. And Adrian, I can put the examples in when we send out our stuff next week for the next upcoming It's Worth a Shot. I can provide that. What I'll probably do is send over the PharmAmerica Did You Know guide, because it actually has the medications listed out, like examples of each medication and each criteria that's listed out. So that would give that. And then Kyla's PDF would also give you more in-depth information on that as well.
I can attach that to next week's reminder for It's Worth a Shot. So it will be on the reminder email.
Wonderful. Okay, Adrian, make sure you take a look at that and reach out if you have any questions. So,
you can go to the next
right.
slide, Mary. We just wanted to remind you that next week we do have Dorothy Colby back on with us, and she's going to be discussing the management strategies for people living with dementia. So again, like we asked at the beginning of the presentation, if you can send us any kind of scenarios that you would like discussed, that maybe you're having at your facility or that has come up in the past, then we can have an expert kind of help, or SME, kind of help walk through that scenario. So again, you can send it to us by emailing Jolene. You can email any account manager that you work with, actually, and they can get it to us. Or you can fill out the evaluation and put it in the write-in section. And we're going to close out the webinar, so it'll be a little late to put it in the chat. But again, we really welcome any scenarios you guys might have to help make the webinar next week more interactive. So thank you again for joining us, and thank you, Callie and Kyla, for presenting for us. And we hope to see you guys next week. And happy Valentine's Day to everybody. Hope you have some special plans or a lot of really good chocolate to eat. So enjoy.